Hi, thanks very much for joining our webinar. We're just going to wait for a few more people to join. Okay.
Does this save to the website?
Yeah.
Yeah. Camera's loading on that one.
Okay, so we're going to get started. So thank you for listening to our webinar on egg donation. My name's Julie, I'm the donor coordinator.
And my name's Debs, I'm the fertility nurse specialist who leads the egg donation program.
Okay, so we're just going to start the presentation. Okay, so why do we need egg donors? So we have patients that for various reasons can't use their own eggs in treatment, and using donated eggs means they can actually carry a baby, which is really lovely for them, and then they are automatically the legal parent as well of that child. So there are various reasons people can't use their own eggs. So for example, if they've had cancer, their cancer treatment might mean that they are unable to produce eggs. They may have been born with a congenital condition, which again means that they might not be able to actually produce eggs or good quality eggs. They may have a genetic condition and they don't want to risk passing that on to a baby. Premature menopause, so that can happen to quite young people, and again that means that they can't use their own eggs. We also have patients who will have had their own treatment with their own eggs and it just hasn't worked for them, and then donor eggs is really then their last shot. And then people that just for some reason produce poor quality eggs. So there are lots of reasons why the donor eggs are needed in treatment. We have a dedicated donor team here at Complete. So we have two consultants, Professor Ying Chung, who's our lead, and Dr. Millie Saran. Debs, who's sat next to me, is our egg donation specialist nurse. Then there's myself as the donor coordinator, and then Amy, who is the donor administrator. She's not on the list, but we also have a link in the lab as well. That's Carissa, who's the acting lab manager, and also our counsellor Judy sometimes gets involved as well. So this is a picture of us, not a particularly nice one, but so that's what we look like. So there is a criteria for donors. We have to have quite a strict criteria because obviously you want the best outcome for everybody involved. So you can see from the list you need to be between 18 and 35, be a non-smoker for at least 3 months. So sometimes we have donors who would like to donate, but they're smokers, but if they're really dedicated they then say, well, I'm willing to give up. So we wait 3 months, and then we can bring them through. You need to be fit and healthy with a BMI under 30, and then one of the first things we do is a blood test called an AMH, which looks at ovarian reserve. That result comes back as a number and our criteria is 15 15 to 35. So that's sort of the first blood test we would do once we're looking at bringing you through. And you need to have no previous history of low ovarian reserve. So if you've had IVF yourself and you didn't respond very well, then unfortunately it means you wouldn't be able to donate. Both ovaries must be in place, and also both fallopian tubes. Have no personal history of transmissible diseases, and we also ask about yours and your immediate family's health, so we need to know there is no family history of any genetic or inheritable diseases. And things like polycystic ovaries and endometriosis unfortunately would mean you're unable to donate, and as I said, fallopian tube disease as well. So then why do people donate? Well, it is a really, as I've said at the beginning, it's a really lovely thing to do, and it makes such a difference to our recipients. I can't tell you how grateful they are to people that donate their eggs. Sometimes it's to help a family member or a friend. So we have known donations. So you donate your eggs to somebody you actually know. So it might be a sister or a friend, just to help them out. And you might know somebody who struggled with fertility and just think, that's made you really think about doing this. And that's not unusual when we ask for the reasons. It's because you know somebody that has been in this position. And then sometimes we have ladies who've completed their own family, know they've still got eggs there that are doing nothing, and they've got such joy from their own families that they then decide they would like to help somebody else. Again, it's a really lovely reason to do that. We also offer our egg sharing package as well. So this is for ladies who need IVF themselves, but it will be for some other reason than their own fertility issue. So it might be a male factor problem, for example, and they keep half their eggs for their own treatment and they donate half their eggs. And again, it's a lovely thing to do, and we do offer reduced price IVF for people that are willing to egg share, but generally, people are doing it for other reasons than the monetary reasons. It just, again, they want to help somebody else that's in the same position as them. So the egg donation process, so it's a 3 to 6 month process, and there's approximately 9 appointments to attend over that time scale. Things are slightly different at the moment because of COVID, and on that issue, just to let you know, Debs and myself are sat so close together because we've both had a very recent COVID test. So as I say, 6 to 9 month process, approximately 9 appointments. In the past, you would have come into the clinic more than you are at the moment just because of COVID. So we are doing more Zoom and telephone appointments. The first step I would say to anybody who's looking to donate their eggs is to read the information that's available on our website, and make sure you're happy with the process, happy with the criteria. And then there's a questionnaire to complete, and that comes back to us and we'll review that. And if everything's great, we'll then talk to you about coming in for a first appointment, which is a blood test. And I mentioned AMH before, so that's the first thing we would do. And it says meet the donor coordinator, but in this current circumstances, you might not meet, we might just speak over the phone. Assuming the AMH comes back in the right range, you would then come in and have, you wouldn't come in, you'd have a phone call with the counsellor, but you would come in to have some screening blood tests. So this would involve infection and genetic screening. So the infection screening is for things like HIV, hepatitis, syphilis, chlamydia, gonorrhea, a whole list of lovely things. And you would have genetic screening. So you would be screened to make sure you're not a carrier of cystic fibrosis. You would have a karyotype, which looks at your chromosomes. And then depending on your ethnic background, sometimes there are some extra genetic tests that we may need to carry out. We also write to a GP and ask for a brief medical history at that point. You would come in and have an internal ultrasound scan. We just need to have a look at your ovaries and womb just to make sure everything's fine before you embark on any treatment. You then come, once all your results are back and you've had all your scans and your counselling, you would then see one of our doctors, probably at the moment, like I say, over Zoom, and the doctor will review all the results and then sign you off as suitable to donate. The doctor would sort of talk to you about the treatment and do some consent forms, and again I would be involved with the consent forms as well prior to treatment. Once we get to that point, we can then match you with a recipient, which we do around characteristics. So we know all about your characteristics. You will fill out a form for us called the donor information form. and our recipients also fill out a form about their characteristics, and that's how we look at matching you. Once that happens, I then pass things over to Debs, who's the nurse will take over. So Debs will be the one who's responsible for synchronizing your cycle with your recipient, booking in, arranging your scans, and going through all of your injection training, drugs. But Debs is going to talk to you a bit more about that in a minute. You will come in for an initial scan to make sure you're ready to start treatment, and then following that 2 to 3 further scans, and then your egg collection. And again, Debs will talk more in depth about what's involved with the egg collection. So what happens after you've donated? So we're not allowed to actually pay somebody to do, it's a lovely thing, but we're not allowed to pay you to do it, unfortunately, by law, but we are allowed to reimburse you. So we are allowed to reimburse donors £750 following their egg collection, and this is aimed to cover the cost of all the expenses of coming in for the various appointments. It's a very small amount of money for what you do, but as I say, that's by law, that's all we're allowed to actually reimburse you. What you can know after your donation, so we ask you if you want to know the outcome of your recipient cycle. So we can tell you a year a child's born, whether it's a boy or girl, and if, for example, it was a singleton or twins. Prior to that, we can actually tell you if there is a positive pregnancy test following your donation. And we ask you at that, once you're at your egg collection, if you would like to know that, and then we'll follow your lead on that. So if you say yes, we'll give you a call a couple of weeks after to let you know if your recipient has had a positive pregnancy test. And you know, if people donate, obviously it's a big thank you from us, because it's a really lovely thing to do. You will see the counsellor during the process. So anybody that's donating or receiving donated eggs, we do ask them to have at least one implications counselling session. And the counsellor will just talk you through, it may be things that haven't even occurred to you. So it's just really important that you have that session so that you're aware of all the implications involved with donating. It's important to know that as a donor, you would not be the legal parent of any child born as a result of your donation, and you have no legal, financial or parental responsibilities at all. It's also very important that you know that at the age of 18, a donor conceived person can make an application to find out the identity of their donor. If that, they would make that application to the HEFA, the Human Fertilisation and Embryology Authority, but every effort would be made then to let you know that application had happened, so it doesn't come as a huge shock to you if a donor conceived child does contact you. So it's very important that over the years, if you move, that you keep us up to date with your new address, for example, so that we have the most up-to-date information if somebody does make that application when they're 18. I mentioned the donor information form before. As I say, that's about you. So you list your characteristics, but we also ask you to write a goodwill message to any child born from the donation, your reasons for donating, and a personal description, which can be shared with any potential recipients. And at the age of 16, we can share that information with a donor conceived child, but that would all be anonymous at that point until the age of 18. So I'm going to pass over to Debs now, who's going to talk to you a bit more about the nitty-gritty of what's involved treatment-wise. There we go.
Hi, I'm Debs. I'm the egg donation nurse. So I get involved with your care once Julie has successfully matched you with a recipient or recipients, depending on the type of treatment that you would be having. So generally, if you come through as an altruistic donor donating your eggs purely for goodwill, then you tend to be matched with 2 recipients. Whereas if you're sharing your eggs, then the eggs would be shared between yourself and an anonymous recipient. Once I've been given your information, then I match up your cycle dates. So the dates of your period have to be matched up with those of your recipient to make sure that treatment's happening at the right time. So we try as much as possible to use the natural cycle of a donor, and often then the recipients are either on HRT, so hormone replacement treatment, or we use the contraceptive pill to match up the dates. Once you've been matched, we can pre-book all your appointments, and we would have a nurse consultation. So as Julie said, at the moment, most of our appointments are done over telephone or via Zoom. So at the nurse consultation, we go through your medication and teach you how to inject with the hormones. And we also send you online links to, as a reminder really, and show you how to give the injections to kind of replace the face-to-face injection training that we would do. We look at ordering your medication and finalise any consent forms that are outstanding, and pre-book all your scans just to make it easier for you to schedule the donation side of things and all the sort of face-to-face appointments around your work and life commitments. So as Julia said, your hormone injections tend to start with day 1 of your cycle. So you come in for a scan by the 3rd day of your period. All our scans are internal and done by the nurses or our in-house ultrasonographer. So the internal scan, the first one, is just making sure that everything's okay with the lining of your womb and making sure that all is well with your ovaries. So there's no cysts or anything on your ovaries before you start treatment. If all's well, then you start injecting with hormones by the 3rd day of your period. So initially you just inject with 1 hormone, and then from the 5th day you introduce a second. So it's about a week where you would be doing 2 injections every day. We like to monitor your progress. So after your baseline scan, you'd come in for a scan about a week later to see how the ovaries are progressing and responding to the medication. In terms of side effects of medication, initially ladies just often feel very tired. Sometimes they can get some headaches as a result of the hormones. And then obviously as the ovaries get larger, as more follicles grow, then you can feel a little bit bloated. But most people seem to cope very well with the treatment. So the first scan after baseline is about a week in, and then we see you for scans every other day until you're ready for egg collection. Now, egg collection normally happens around the time of ovulation in a normal cycle, so about 2 weeks into your cycle. So it's about an average of 12 days of injections in total. Once you're ready for your egg collection, you have one final injection that's done in the evening at a very specific time prior to your egg collection procedure. Your egg collection is done under what we call conscious sedation, so it's not a full general anaesthetic, but we treat you as if you were having a full general anaesthetic. So you have to be nil by mouth from midnight the night before your procedure, and you will need the entire day of the egg collection off of work and someone to come and collect you after your procedure and take you home and be with you for 24 hours afterwards. So you get to the clinic nice and early in the morning and you meet our consultant anaesthetist, who will pop a little needle into the back of your hand, through which they give you some nice medication to make you feel pleasantly sleepy. The egg collection procedure only takes about sort of 20 to 25 minutes, and with sedation you wake up very quickly afterwards. We bring you back to our recovery bay and we give you some tea and biscuits. You stay with us for about an hour or so afterwards, and then you're good to go home. But as I say, someone must come up to the clinic to collect you, take you home and be with you for 24 hours afterwards. We'll know how many eggs are collected before you go home on that day. After egg collection, you can expect to feel a little bit of pain, but most patients seem to cope very well just with paracetamol. And then after that, you can expect your period to arrive about 2 weeks after the date of your egg collection. The bleed that normally follows after egg collection is just often patients describe it not as a normal period, so sometimes slightly lighter or heavier than they would normally anticipate. So there's just some images here about the egg collection. And once your eggs have been collected, they're sent through to our lab, which is in our complete fertility clinic. And in the lab, unfortunately, I'm not an embryologist, but they, as far as possible, trying to recreate the environment within the womb, within incubators, to make sure that everything's optimal for the egg's development and growth. To make the injection side of things easier, we're really fortunate to be able to use an app which is called Medemo. So when I see you for nurse consultation, then I would talk to you a little bit more about the Medemo app. So you can download it onto your phone and it's free to download. And it sends you notifications about your medication. So if you're worried about remembering to take your drugs, it tells you what drug, what dose, and when to give it. There's also options to record mood management as well. These are just some images of our clinic. So we're really fortunate to have a nice refurb a couple of years ago. So this is just some pictures of one of our embryologists, and the picture in the top left-hand corner is what's called a dewar. So that's where any frozen eggs, sperm or embryos get stored in liquid nitrogen. This is some of our consultation rooms, so where you would see one of the nurses for your scans. And this is our recovery base. So after your egg collection, we would bring you back into this room where we'd give you tea and biscuits, keep an eye on your blood pressure and make sure that you're okay before you go home. And the last picture here is just a picture of our theatre. So this is where your egg collection takes place. So it's very small, and then it links up with our embryology lab, so the eggs are transferred directly into the lab. Shall I stop the share? Yeah. Lovely. I've got the attendees, yeah.
So that's the end of our presentation. Thank you very much.